Imagine this, you are on ward call and you're called to see a lady you admitted the night before with a laceration on her leg after a crush injury. You arrive to find her like this. She arrests, and despite your best efforts, she dies. You despair. You think, why has she died? Why? Why has this happened? And you turn to her medication chart, and lo and behold, you find there is no medication VTE risk assessment completed. You despair. There's another avoidable death from venous thromboembolism, VTE. Another mother loses her child, another family their loved one. There is another coroner's inquest where the finding is VTE, no risk assessment carried out, and pulmonary embolus as cause of death. Another medical career is irrevocably changed. This is not good enough. This is not a joke. But together we can work on this and find a better way to avoid these medical misadventures. In Australia, over 20,000 people per year suffer from VTE, and over half of those occur in and just after leaving hospital. But over 2,000 of these people die, as we have seen here today. It is the #1 cause of death in hospitalised patients. Enoxaparin can reduce these risk of VTE by half without any increased risk of bleeding. We must complete the VTE risk assessment, and we must complete our medication chart correctly. Thank you, Alina. We have a duty of care to assess this risk and fill out the medication chart correctly. So now let's look at a prime example. What we'll do is you have a blank medication chart in front of you. We will pick out a chart that has errors, and I'll give you a hint, it has at least 3 errors per page. And I will get you to press pause and identify these 3 errors and attempt to put them on your blank medication chart. Remember, by doing you will learn. So have a look at the first page here, the front page. I'll just show you underneath. And identify 3 errors, and we will go through it. All right, here is the medication chart with the correct entrance. So first we have to match our sticky label and write Miss AB's name again, and her height and weight. Now, of course, we must look for allergies, and there was no allergies in the other sheet. So Miss AB actually has a penicillin allergy with a reaction of a rash, and your name has to be written down and countersigned. Also, we need to write the year and fill out the rest of the front of the page. Okay, this is the sheet with errors, the medication sheet with errors, so I want you to have a look at this sheet, press pause and see if you can find 3 errors on it, and then we will go through with the correct sheet. Okay, so let's come to the correct page again. So you can see that we have to assess the VTE. The incorrect page with errors had no VTE risk assessment. We have to sign it and date it. We have to elect the drug we're going to use. In this case, it's enoxaparin. We have chosen a dose. We have signed it and printed our name. We have chosen a time, and we put a square around the exact time we want the first dose given and the route. Now we come down to the next part. The paracetamol we have written clearly and legibly with black pen. We have used the generic name. We have chosen an hourly dose, and we have written down the times and a square when we want to start. We have put down an indication, and we have signed it and printed our name. Now we only have to do that once per page. The signature then will carry on as long as it's legible. Now we can see we have written an incorrect medication here because we know now we have a penicillin allergy, and that needs to be deleted and cancelled, signed, dated, and the reason why is allergy. That all has to be recorded. Now we have chosen another medication to use, an antibiotic. We've written every 6 hours, and we have again indicated when we want to start this, the timing and the reason why, and the signature. I'm going to go to the back page of the medication chart with errors. Now I want you to look at this, press pause if you need, and write down 3 errors that you can see. Okay, now let's look at the correct medication chart. We have put the sticker on. There was no sticker in the other chart. We have signed Miss AB's name and the year. We have mentioned the generic name of the medication and the dose that we want, the maximum dose in 24 hours, which was not done on the other chart. We have indicated every 12 hours. We not write BD on this chart as a PRN. It has to be written an hourly frequency. We have to write the indication, and again we sign and print our name because it's the top of the page. Remember, fill out the VTE risk assessment form correctly, fill out the medication chart correctly, or you risk a coroner's inquest, you risk the patient's life. Let's all work together to reduce the risk of VTE and medication misadventure. Thanks.